And turning to health news now, diabetes and peripheral vascular disease are the most common reasons for limb amputation. The Spectrum Health Limb Care and Preservation Clinic's top priority is providing collaborative care to preserve limbs and save lives. Join me now with more information is board-certified internal medicine physician with Spectrum Health, Dr. Richard Hodgson. Thank you so much for being here with us this morning. Okay, well, you guys have a very important discussion coming up. We call them Doctor Dialogue. So when is that taking place, and what will people learn, and who will they hear from there?
That'll be November 10th at Calvin College Prince Conference Center. And what they're going to hear is a dialogue about peripheral vascular disease, how to prevent it, things you can do if you get it. We'll also be talking about limb preservation, things you can look out for, try to prevent it, and what can you do if you get limb-threatening problems. For instance, a diabetic with a foot ulcer. Those folks have a very high incidence of amputation. And if they have an amputation, the natural progression is that it is a very telling portion of their health, and they will have a very higher mortality regarding longevity. They will die within about 5 years.
Wow, that's eye-opening right there. But tell us about the limb care preservation clinic that you guys actually have at Spectrum Health. You guys have a great team in place.
Well, we've been taking care of wounds and diabetic feet and things of that sort for many years, but the problem has always been getting the resources to the patient. Instead of sending the patient to the resources, we've brought all the resources to the patient. On-site diagnostics, the specialists, treatment, and ultimately the goal is to preserve as much function for a person as we can. Unfortunately, prevention is the better portion of what would really be best for the patient. By the time they get to us, it's many times putting things back together. Good foot care, good control of diabetes, trying to do the things that are right to prevent peripheral vascular disease will tend to keep people out of my clinic.
Absolutely, right.
We'd love that.
Absolutely, yeah, that's right. You'd love to go out of business, right, if you could.
That's the goal.
In a sense, absolutely. So you talked a little bit about diabetics, but what other types of people actually come through, what other types of patients come to the limb care clinic?
We see about 5 major things: diabetic foot ulcers, peripheral vascular disease and leg ulcers, people with venous leg ulcers, pressure ulcers, and non-healing surgical wounds.
At this point, what has kind of led up to some of these people ending up in your office? I'm understanding maybe some of it could be hereditary, some could be just lifestyle, right?
Well, many portions of it relate to lifestyle. Overweight, not getting good exercise, not controlling the diabetes appropriately, not having proper footwear. That's the #1 cause for people to get foot ulcers if you're a diabetic.
Okay, so they have a great team in place. Of course, if people are watching right now and they're saying, okay, this is me, it's drug on long enough, where can they go about finding your team and reaching out to you guys?
Okay, they can call us directly. They can look at Spectrum Health's website and look for limb care, and or they can search for our phone number. We are located at 221 Michigan Street. Right across from Butterworth Hospital.
All right, everybody knows exactly where that is. And people are watching at home, we had the information right there up on the screen for everybody. Of course, we know everybody doesn't have always access to the internet and that sort of thing, so giving you guys a call is great. But once again, you want to register for that Doctor Dialogue so they know how many people to expect. It is on Tuesday, November 10th, so a week from tomorrow, 6:30 to 8 at Prince Conference Center. And for more information and for registration, go to shmg.org/events. And the registration for this event is free.
Yes,
so really some helpful advice. All right, thank you so much for dropping by.
Thanks,
Absolutely, absolutely.